Good afternoon. My daughter has been after me to take up yoga for years, and she would extol its virtues. I have never gone to a yoga class, but yeah, I get plenty of exercise, and I have a whole set of stretches I do to relieve my aches and pains. And when I saw, when Damodar had recommended Dr. Dilip Sarkar, I was quite interested in hearing what he had to say. And then I was completely impressed by his bio. I mean, I feel like I am going to hear the oracle on yoga. So please give a hearty welcome to our speaker and be prepared to learn some things that will benefit you in your future. Dr. Dilip.
Dilip, do I give you the spotlight for everyone first or the share screen?
No, you give me the spotlight for everyone first. And looks like I don't need a share screen. I'm going to just, because of your time frame. Okay. Did you give a spotlight for all?
Yeah, I gave it just now, and then I have also given you share screen. Dilip.
Okay, and you can hear me good?
Yes.
Yes.
Okay, good afternoon. Thank you. Thank you, Dan. We've been communicating for a long time, and thank you, Damodar, and the whole Langley Alumni Association. You will have a little treat, as Dan was saying, and his daughter was right, why she was after him. I'm going to talk to you about yoga as a therapy for health and healing. And I'm going to go a little bit of a brief introduction. Then I will share with you a little very gentle practice, what our, not elderly, our young body and mind can take. It will be all in a chair, sitting in a chair, or maybe a little standing up. And I will show you a little bit more. And if you want to do it with me, it's fine, or if you want to watch it. The first, let me explain to you a little bit about yoga practice and exercise. Dan was saying, he was exercising and his daughter was after him. There must be a reason. The yoga is a time-tested, a traditional system of healing. And its origin is in Indian subcontinent. The place presently is called the Indus Valley Civilization. The practice first was designed for called a mind-body union. That's the word comes from. Yoga comes from the root word called yog, which means union, union of your mind and body. And the practice came to quiet down your mind. That's what we call it. We have a chattering of your mind. We have all what we call a stress. We call a sympathetic overdrive. This is driving our heart rate up, blood pressure up, respiratory rate up. And in the process of that practice, what was at that time was called a self-realization. It was noticed that by a regular practice, there is a lot of health benefit. And we, as a physician, we started looking into it and we incorporating it in our Western medical practice in the new rapidly developing branch, which is called integrative medicine. I'm a retired vascular surgeon. I've been in this area for over the last 45 years. And I also retired a little early for a reason. And I had an open heart surgery. I had a triple vessel coronary bypass about 20 years back. And thanks to this yoga practice, it totally changed my life. I'm disease-free, medication-free. I'm enjoying a good quality life. The first, as I said, it's a relaxation response. It's an activation of parasympathetic tone. So what is the difference between an exercise and a yoga? Exercise is a muscle contraction. It is rapid. I'm taking a 10-pound weight in and out, in and out. I'm doing a rapid. And it increases my sympathetic tone. My heart rate goes up, my blood pressure goes up, my respiratory rate goes up. Then my body's, we call it a default mode, or we call it a body's homeostasis. The body wants to bring it back to normal. So body starts producing a parasympathetic tone. And this parasympathetic tone, followed by a sympathetic overdrive, gives us the health benefit of exercise. So I'm exercising, my pulse rate is going up. Pulse rate is going up, 110, 120, 130, we call 220 minus your age. But I'm not concerning about the pulse rate. After the exercise, my pulse rate comes down. And this is called a resting pulse rate. After an exercise and after for certain exercise period, my pulse rate comes down. So the resting pulse rate down is the final effect of exercise. And a practice of yoga, which is a primary relaxation response, which is holding a pose for a little longer time and coordinating with your breath. This is a very important practice, which we'll go through very shortly, and you will see. And we'll go maybe about, I don't know how much Dan gave me, half an hour. We'll be doing very simple practice of half an hour, sitting in a chair and standing up a little bit. And I will have some time for question and answer, and you will see how it affects your body and mind. I see Damodar's wife, Manjula, is also here. She has attended, and Damodar also, they attended my class. I was teaching also in Peninsula before this pandemic. So coming back again, our lung is like a balloon. It has a 6-liter capacity. It needs 1.5 liter to stay inflated. And it is a 4.5 liter of gas which can be exchanged, which is we call a vital capacity. But in normal breathing, we only breathe 500 cc or just half a liter. So think about it. We are breathing just for a half a liter, and we have a reserve of about 4.5 liter. That means over 80 to 90% lung has a reserve. And that's actually, we are using it and tapping in the lung function to even the patients with COVID-19. Yoga as a therapy is a wonderful tool for COVID-19. So all practical purposes in the yoga practice, first we learn how to breathe out. Remember, the lung is full. Lung is full with carbon dioxide and other gases. And the function of the lung is that I breathe in fresh oxygen. Oxygen goes from the lung to the blood. And from the blood, the carbon dioxide comes, it comes out. Now, if when my lung is full and I'm taking a deep breath in, all the air is sitting in the top of that residual air and they are not functional. The first thing to learn is to how to breathe out. And when you're breathing out, the second technique is slowly take a deep breath in without any effort. That means it will be like your normal breathing. And breathe out longer than breathing in. When you breathe out longer, the breathing out is, we call it a parasympathetic, and breathing in is sympathetic. Breathing out is all the toxic carbon dioxide gases. Breathing in is the fresh oxygen. So what we do first, we first learn a technique, how to relax our physical body. If we learn how to relax our physical body, then our breath becomes effortless. Remember, very simple example. When we are stressed, when you are, say, afraid, fearful, stress is nothing, but we call it a fear of unknown. What stresses me? Yeah, my kids are going to school. I don't know what will happen, whether there will be a mass shooting. I'm in a plane, whether it's going to hit the World Trade Center. This is a fear of unknown. I'm going out, whether I'm getting COVID-19. That really causes my stress. So in the stress, we get a very rapid, shallow breathing. But when you're calm and quiet, your breathing becomes very deep and slow. And look at the word he used. We see a beautiful picture. What do you say? Breathtaking. When somebody is very upset, anxious, the word you'll take a deep breath in, breathe out. So the first component of a relaxation, which is a daily part of your life, which all of you should do, and you'll see how effective it is, to keep your spine straight. Sit down any place, anywhere with your spine straight. What does it mean? My skeleton, if you let my skeleton stand up, is going to fall in the front. So all the muscles in my back, they're called paraspinal muscles. They're contracting to keep my skeleton straight. So if I give some relief, say I'm feeling my back muscles, they're just tight. It's like two bricks sitting here. And that happens with a chronic low back pain. So when a chronic low back pain, what happens? We get herniated disc, we get a spinal stenosis, but they don't cause pain. Pain is caused by irritation of a nerve or a nerve root and contraction of the muscles. And the pain fiber always comes from the muscles and the ligaments. So let me show it to you, and if you want to practice with me, I sit down in a special chair. I'm sitting in a special chair in front of my computer, but I'll show it a little later. But let me grab a regular chair, and I'll show it to you before I show you my chair. Suppose you have a regular chair. This will be your everyday 24/7 practice. If you sit down in the front, you'll keep your spine straight. You keep your spine straight. That's the way. If you're sitting in front of a computer, you'll use a computer. If you're eating, if you're in a dining table, with the spine straight, this is the way you'll be using your knife and fork. Always keep your spine straight. If you sit down in the back of the chair, go to the back of the chair, always keep your spine straight. Suppose I do the same way all the time, 24/7. I will be driving my car, I will be sitting down, and this I have incorporated in my life. In a short time, I will see my breathing gets better and better. Normally, if I'm breathing about 500 cc, with the relaxation after breathing out, I would be able to breathe in about 3 or 4 times more than what a person can do. For a long, long time, I'm using a chair, which many of you may have seen and may not have seen. This is called a kneeling stool. And I use this kneeling stool. I have about 1, 2, 3. I have 3 kneeling stools in my home. So you sit down here and put your knees here. No way you can keep your spine bent. Your spine has to be straight by sitting in a kneeling stool. And what you find out, people who are hunchback and looking in this computer screen, they are getting a lot more lifestyle-related diseases, which we call diabetes, hypertension, heart disease, and a trunk of obesity. And see a lot more in the IT people. So I will be sitting here, and this is a chair for me, which I sit all the time. So how comfortable I am when I'm sitting here, and I'm here. This is my keyboard, this is my computer, and since I'm a little distance from my laptop, but I have my main desktop upstairs. This is my also. Remember, Dan was saying that you will exercise. I do. I practice every day, morning. I do my yoga practice, relaxation response. Every other day, I do my treadmill, I do my little weight training, and I also incorporate my yogic principle. And let me start showing you next few minutes how to do a little bit of a relaxation response. Look at a person who's completely relaxed. A person who's completely relaxed is half a baby. If you look at a baby, now we're going to observe a baby. Baby, every posture baby has is a yoga pose. They will get up in a downward facing dog. They will sleep. It's called a closed angle pose. They even close the hands. You will see that if you look at a baby hand, I don't know if you have seen or have noticed one time, babies will close their hand. Babies will take the hand, they will take the thumb inside and close. This is called a baby fist. Look at that. This is called initially thumb will be here. So if you want to try, practice with me, try this. Take your hand, try to see if you can put your thumb inside and close. Do it a few times. Open it up and close it. This will create a profound relaxation of your hand and wrist. All the pain in my hand comes from the tightness. The arthritis, osteoarthritis, rheumatoid arthritis, inflammation causes a splinting, causes the tightness of my muscles and ligaments. You can practice with your breathing. So if you want to do it, you can put your hands in the front and breathe out first. Take a deep breath in and close your hand and breathing out. Breathing out, close your hand like a baby fist. This is also called a yogic fist. Breathe in, breathe out. The moment you follow your breath, you are going to develop a relaxation response very quickly. I'm going to show you just very simple tricks you can do sitting in a chair, and then I'm going to show you a few breathing techniques. Wrist gets relaxed with the expansion. Breathe in, breathe out, drop your wrist down. Breathe in and breathe out. So what happens, slowly and slowly, my body develops a habit forming. What is, we call a medical term called neuroplasticity. So you're talking about people doing yoga, we said, oh, they're putting their body in this, like all the twisted form, like a body in a pretzel. Not the body in pretzel. In stages, impossible become possible. But let me show you what happens. When your hands are relaxed, your fingers will be separated. Your fingers will be separated. It will be not closed. You put your finger in and out. If the fingers are tight, fingers don't go in. Relax, will go in and out. You can put your hands all the way around. So when you are relaxing, your breathing becomes better and better. So shoulder is a ball and socket joint. If you can slowly put your hand in your shoulder and bring your elbows close. Now you have to listen to your body's signal. You are not competing with anybody. What is the first body signal is a pain. If you have any pain, bring it here, back off. Find a place which is, we call it a comfortable discomfort, and you practice from there. In my class, what we do with our eyes closed. When you do eyes closed, you really don't know, and you can follow. So if you can bring your elbows closed with your breathing, breathe out first. Take a deep breath in, breathe out, slowly rotate your shoulder. That's the way to do it. Breathe in, breathe out. Slow, gentle with your breathing, and best way to practice is to eyes closed and coordinate with your breathing. And a relaxation practice of yoga is a very wonderful for the senior citizen like us. We causes the relief of your chronic pain. And then do opposite. Start here, breathe in, then opposite. Always try to balance. It always brings a balancing poses, and I will show it to you very simple how to balance your both sides of the body. Remember, we had the two sides of our brain, right brain and the left brain. And what happens, just simply think, I'm right-handed, right-footed, I'm always using my left brain. I'm not using my left hand much, but yoga tells you to use your non-dominant side. Use your left hand. Try to brush your teeth with the left hand. What will happen? If you hold your brush, the brush will be all over. It will never come close to your mouth. And the moment it will come close to your mouth, if you can brush it, you know what will happen? Your other hand will be doing like this. Because your brain thinks you are brushing with your right hand. I'm sitting down here. I'm not sitting down. My brain is allowing me to sit down like this. So another yogic technique to quiet down your mind. Our hand connects our body and mind. See, our hand, you'll see the hand gestures before you can talk. You like something, you'll say this. You want something, you say this before you say give it to me. So in a yoga, they do a hand gesture which is called mudras. If you touch your index finger and thumb, and if you gently put over your knees and keep your spine straight, then slowly start doing your breathing technique, which will bring relaxation. So I'll show you two breathing technique, and you will see slowly and slowly your breathing will get better and better. Why? The muscles of respiration are called skeletal muscles, which can be trained. Like I'm doing a biceps curl. I'm doing it at 10 pounds. In a few days, I can do 15 pounds. I can do 20 pounds. Skeletal muscle. So this muscle, which affects my respiration, will do the same thing. So spine straight. Breathe out first. Take a deep breath in. Breathe out longer than breathing in. Let's do a few counts, and those two increasing. Let's count it if you can do it. Let's count it very simply. You can do count of 2 in, 1 and 2 in, count of 4 out. 1 and 2 and a 3 and a 4 out. Just increase the count of 3 in, count of 6 out. We have been doing it so long, we can do count of 8 in, count of 16 out, count of 10 in, count of 20 out, but it has to be completely effortless. Effortless means you can talk, you can even sing. Let's try. Close your eyes. If you close your eyes, you will see you breathe a lot better. Breathe out first. Count of 2 in, count of 4 out. For me, it is very simple because I've been doing it every day. So let me just show it to you. And you practice it, it will happen to you. And this breathing will improve your whole health and healing. Why? I'll tell you very shortly. Now let me show it to you. Count of 4 in, count of 8 out. And breathe out first. Breathe in with a count of 4 in. And count of 8 out. Very simple for me, very easy. Just to give you an example, let me do count of 8 in, count of 16 out. So you'll see the difference. Breathe out first. Count of 8 in. Count of 16 out. So it improves your lung function. So what does it mean? Suppose a person who is dying, what happens? First, last breath, as a patient expires, lung stops, then the heart stops, then the brain stops, then all the cellular function stops. So to improve your lung function, your heart function gets better, your brain function gets better, cellular function gets better, and this cellular function, which is responsible for our immunity, it's called T cell. T cell secretes our immunoglobulin and this basic improvement of our immunity. Remember what's going on today now. We are all talking about vaccine. Vaccines are great for COVID-19, but COVID-19 is also smarter than us, and it is developing a variants very quickly. And it developed the variant so quickly, and the vaccines may not be effective. So let me show you the whole area of respiration, how to relax. It is called a prayer pose to the back. So if you want to try it with me, and let me show it to you slowly, so if you can see it, how to do it. If you can bring your hands close, wherever it comes, remember you have to start from somewhere. You are not competing with anybody, you are competing with yourself. If you can put your hands together, then slowly you can bring it up. It's called a prayer pose to the back.
Can't do it.
And if you stay in this posture a little longer, breathing out longer than breathing in, a relaxation will set in. Maybe in 1 week, 2 weeks, 3 weeks, will come up here. Keep doing it a little longer, it'll come up a little bit more.
Oh, God.
Right? Finally, it'll come up to here. But this is not the answer. What the answer is that you will be able to sit down. You'll be able to sit down with a prayer pose to the back as comfortably that this is your normal posture. So I'm talking, I'm breathing, I don't have any pain. Remember, when you do a little imbalance in your physical body, it shows up in your breath. If you start doing a little spinal twisting, you'll see your breath gets interrupted. Now, think about myself. I was a surgeon. I was operating. I was bending my body down. I was operating. My body was like a stick. So when the transformation takes place in 20 years back, after my open heart surgery, today, after this practice with the breathing, my body is like a rubber band. You can name any pose. We call this called asanas, and I can do it. So this is very important for your breathing. Very important. Next you do for your balance, extremely important. Remember for us, all the senior people, the number one cause of the trauma for us to death is a fall. We fall down, what will happen? You'll have many of us we are taking aspirin or anticoagulants, you have a bleeding inside the brain, and that's the end of our life. Pelvic fracture, your hip fracture. So initially you can start again, take a chair or just come next to the wall. And a simple technique, bring a balance. If you stand up, we're very comfortable standing like this, separating our feet. Put your feet together. Put your feet together. Always keep your body straight. Your ear, your shoulder, your hips, and the ankle will be in a straight line. Remember, when I fall down, I've always followed an outstretched hand because hand also helps my balance. We got a fracture called a Colles fracture. So hold your hand for me. Generally I do. I put my hand in the back like a prayer pose. I'm right-handed, right-footed. See if I can stand on my left foot. I will try to stand on the left foot. Initially, if you cannot, hold on to a chair. Hold on to a chair or hold on to a wall. Stand on to your non-dominant foot. See how long. 10 seconds, 20 seconds, 30 seconds, 40 seconds. It's a wonderful practice. Once it happens, finally, the final proof is you can close your eyes, and if you can stand in one foot, that becomes the sign of your health. My eyes are closed, I'm standing on one foot. Initially, it becomes almost impossible, but when you can do it, you are guaranteed. We call it money back guarantee. Guaranteed it will protect you from your fall. See, people walk like this. People walk like this is not falling, it's a fear of fall. So then you will be doing again, balance into the opposite leg, opposite foot. Once you cross 30, 40 seconds, you are a profound effect on your body and mind. So remember, relaxation response and balancing. Then comes very interesting one, which if you can try, that will bring a profound effect of health in your body and mind, that you're able to sit down effortlessly. This is called a squatting pose. Remember, I get a pain. I have a knee problem, hip problem. You don't have to go down. What you do is try. Try, get a chair. Try where you can come down. Come down here without any, stay in this posture. Stay in this posture with your eyes closed, breathing out longer than breathing in. After a few weeks, this will happen. And then finally, this will happen. This is called neuroplasticity. We call it a habit forming. After 20, 30, 40 inputs. And then the most important sign of health is going to be able to get up without a support. If you can practice this every day in the morning, the whole relaxation response will set in. Your immune system will get better and better. Sitting down and getting high up. And let me show you finally, probably most of you won't be able to do it at this time, how far we have. So I've been practicing for about 55 years, so I'm 39 and holding. You can sit down, look at this, I can sit down in the ground, and this is being tested. This is being tested thousands and thousands of times by a lot of cardiologists. Stay here, this will be better. Okay, just to show it to you, in a very short time. Sit down here, and I'm able to get up without a support. If you can come up to this technique, this portion, you are going to save yourself and going to bring your health and healing. Finally, before I have a very long class. We do a whole, relaxation of our neck, relaxation of our hips. And I have a book. Actually, I have a DVD. It's called Yoga Therapy for Health and Healing. And nobody has a DVD player anymore. But I have a YouTube channel. My full name called Dilip Sarkar Yoga. And I have a YouTube channel, every ailment you can think about. Yoga therapy for knee pain, hip pain, back pain. And I also wrote a book. The book is called Yoga Therapy, Ayurveda and Western Medicine. Ayurveda is another traditional system of healing, and it's available in Amazon.com, and it's become very popular. Had a picture of every poses, asanas, every breathing techniques, and it's all my pictures are there. Very popular amongst yoga therapy practitioners, and we do a lot of, call it daily routine. Let me take a couple of minutes now before we finish. We wake up in the morning, and we do a called a yogic daily routine. The first yogic daily routine we do, it's called your drinking water in a squatting pose. We generally use a copper vessel, and we keep a water in our nightstand and have a room temperature. And then the reason for a copper vessel, the copper ion is the one electron, has a lot of properties, but that's another long discussion. I will hold the glass and I'll drink water one gulp at a time. When I do the gulp sitting down, what happened? My peristalsis starts, and also got a gastrocolic reflex. My stomach stretches, my colon contracts. Sitting down in this posture, we have called a relaxation of our levator muscle, pelvic floor, a very easy bowel movement. I have a easy bowel movement first thing in the morning. Next, what we do after brushing our teeth, we do okay, how long more time I have, Damodar? 5 more minutes? What time want me to finish?
You can take 5 more minutes.
Yes.
5 more minutes, okay? I'll finish in 5 more minutes. So we use a tongue scraper. Use a tongue, and if this is a tongue scraper, brushing doesn't help. If you take out the tongue, take all the gum from your tongue, what happens when you put the food in the mouth, it helps you in digestion. Finally, we use it's called a neti pot, the daily wash our nostril. Because we wash our face, wash our mouth, wash our whole body. This is the area where we call it a life force is going. We put a little lukewarm water, use a salt, like a non-iodized salt, put it through one nostril, close our eyes. Initially it irritates a little bit, but slowly irritation goes away and more relaxation sets in. Open my mouth, breathe in through the mouth, and the water comes out very easily. If you want to see how to do it, I have the whole thing in my YouTube channel, and you can take a look. Finally, there's a breathing technique. It's called a bumblebee breathing. Another is called your pumming and cupping. That's the one which will be doing a profound relaxation. What happens, we have 5 senses. I hear, I see, I smell, I taste and touch. I shut down all my senses. Then I create a vibration like a bumblebee. My brain also has a vibration. 2 vibration interacts and it cancels. In physics, it's called a harmonic resonance. So vibration of my mind quiets down, and it's called a chattering of your mind goes away. I will do it, show it to you, and then we do what is called a pumming and cupping. We rub our hands, generate our heat, and we put it on our eyes to relax, and then we massage all the face. So I put my index finger on my forehead, in between my eyebrows, use my 3 fingers to close my eyes, use my thumb to close my ear, and I close my mouth. I will be breathing out through my nose and breathe in through my nose and breathe out with the sound of a bumblebee. Breathe out first. Take a deep breath in through the nose. Take both the hands, keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, you remove your glasses. Take both the hands like a cup. Put it over your eyes like a cup. Let the eyes take all the heat from your hand. What it does, it relaxes all the eye muscles, called the ciliary muscles, relaxes your eyes. Then massage your forehead, massage your face, massage your ear. Go to the back of your ear, front of your ear, even inside the ear canal and the ear lobes. There is a branch called an auricular branch of vagus nerve. And vagus nerve is an activator of your parasympathetic tone. Bring your hands, massage in front of your neck. There is an organ called a carotid sinus. Carotid sinus also activates parasympathetic tone. Massage your back, it all relaxes, and it puts you in a profound level of relaxation, and it quiets down your mind. And that is really the primary practice of yoga, which really creates a proper health and healing. And most of the yoga practitioners, we are doing a big study now, will be surprised if I tell you. We have a study going on in Harvard, in Beth Israel Medical School, and there is the Indian Yoga Association doing a survey for people who are regular, almost daily practitioner of yoga. Hardly they have any COVID-19. They do not have any COVID-19 at all. And remember, vaccine is not a panacea. Your body's own immune system is the therapy. Activation of your own body's immune system. Thank you again for letting me present a little bit of yoga therapy for health and healing. I will ask Damodar to take me out from the spotlight for all. I will come to a gallery view and see if you have any question. Please unmute yourself or make a comment. And I would like to see what Dan has to say why his daughter was after him. Must be a reason now.
Yeah, that's very interesting. And I have to admit, I was telling her how I was getting a position. I hadn't looked at any yoga information, but to make my back feel better, I was getting on the edge of a chair, like you were saying, and putting my shoulders back, very comfortable. But then I noticed to breathe, I had to breathe out first, just by sitting there. And then I could breathe in. And she goes, "Oh, Dad, what are you doing? What are you doing?" You know, because she was worried I was doing something myself. But here you're teaching us how to breathe, and I'm very impressed because I have to say to everybody, I've experienced some of this just by playing around myself, and I really appreciate learning more about how to do this properly and to get the benefits of just breathing and relaxing. And I could use as much as I could get, I'll tell you.
Thank you, Dan, for sharing. But see, it makes a sense. It's a balloon. Unless you empty the balloon, you cannot put the gas in.
Right.
So you're doing it right anyway. I know this is also called your intuition. It is called your introspection. You know, daughter was saying what you're doing, but exactly what you're doing, we call it a very interesting way. We said by the time you keep on doing it, you develop a introspection, and it's a doctor within you who wakes up. And it basically, you know, Damodar, what it is a unlocking the power of our own healing. You know, even if you have any ailment, given a time, the ailment, a chronic ailment will heal by itself. And if you think about even COVID-19, think about it. COVID-19 has no treatment. We are all talking about dexamethasone, talking about remdesivir, nothing. You know, what we're doing, we are supporting a person with the oxygen supportive therapy, so the body is taking care of its own healing. So is there any messages? And I see some chat room there. Somebody wants to ask something. Damodar, if you can read the...
Dan can read that.
Yes. Yeah.
Dan, can you read what is there in the chat room? Anybody have any question?
Yeah, Dave is just saying that he has to leave at 1.
Oh, okay.
I am sorry to the membership. I didn't, before you started talking, our usual way for questions is for them to post to the chat. And I didn't prompt the members to do this, but I am going to, we have several minutes. If any questions, just speak out and you'll get the floor.
No, I kept the time because basically what I've shown to you, I'm sure Manjula is here. Manjula knows.
Yes, I want to.
The tip of an iceberg, I mean, we do a lot longer. We do but it's a very gentle, relaxing practice. And at the end of the practice, I tell you, nobody wants to leave. They said, "Oh, I feel so great. I feel so good." But what do you tell them? Go home and practice.
Yeah, I have one question. You said your local class doesn't meet anymore, or are there any local classes that do meet?
Yeah, no, there is no local classes anymore. So what we're doing for last over 14 months, we're doing it through online. I do every Saturday morning at 9:30. There's a Facebook Live. So for Facebook Live, and also goes to a YouTube. These are the only media we can do. I have another teacher. Her name is Abha. Abha is also, she lives in Peninsula. She does a Sunday at 4:30. She does it through Zoom. She sends a Zoom link.
Okay.
I don't know whether Damodar gets the.
No, I think Manjula and I get that Dilip. So what we can do is we can send it to Dick, and Dick can distribute it to the LAA members, and whoever is interested, they can dial in and participate.
Dr. Sarkar, thank you so much. This is Manjula. I'm so glad you did this today. For everybody, I started with Dr. Sarkar about maybe 12 years ago. He used to come to our clubhouse. And it's really interesting that I have been on and off. I took some of his classes. The practice, I remember still Dr. Sarkar says, it's 90% practice, 10% knowledge. So I think my knowledge, I'm doing better. Practice, I still need to improve. Consistency. I definitely do better, both mentally and physically, when I do 3 times a week. But do I do every week, 3 times a week? No. So definitely the practice, both the mind and the body. I do know all the poses, thanks to Dr. Sarkar and Abha. But it's just taking the time, putting myself in the zone. Dr. Sarkar, I want to tell you another thing. Even that, I rush through sometimes, and that makes a difference. When I rush through, I just have to do this 20-minute yoga. That is not the same like taking the time, doing it with that clear mind. And that makes a big difference. Even today, thank you so much. Again, it inspired me to get back into my practice. Thank you, Dr. Sarkar.
So thank you very much, Dr. Sarkar. So as you all know, he's a very well-recognized vascular surgeon, like you mentioned. And Dan also mentioned that. And he was also a medical professor. And he is a world-established yoga teacher, so he teaches internationally in a lot of countries, So thanks for taking the time and, spending it and teaching us some techniques. So hopefully you all enjoyed it, and you will appreciate it if you practice it more.